Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about patient discharge policy. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with likes and follow. This policy is applied to all hospital employees involved in discharging patients. Purpose of this policy is 1. To ensure a timely and safe discharge from the hospital. 2. To set guidelines to be followed when a patient is to be admitted in our hospital for treatment and when discharging a patient from the hospital after the course of treatment is completed. 3. To provide the highest possible level of quality service to internal and external patients upon discharge from our hospital. Definitions. Discharge is the termination of the grant of lodging, formal release of an inpatient by the hospital. This is implied by entries in the discharge register. Discharge planning is an interdisciplinary systematic process which aids patients and their families to develop a feasible plan of care after hospitalization. This process will result in the safe, timely, and appropriate discharge of patients to their next level of care, whether it is ambulatory care services, home, or to another care facility. Policy. 1. Patient discharge. Discharge of patient from the hospital is the responsibility of the treating doctor. The nurse should check that discharge order is documented in the doctor's progress notes and instructions are complete, including home medications, OPD appointment and follow-up, number of sick days, as well as referral instructions to any primary health center if deemed necessary. Other related health providers involved in the care of patient must be informed before discharge. A medical report is provided to all admitted patients by the medical record department upon formal request of the patient, his family or sponsor, employer seeking sick leave privileges after discharge. Discharge summary of patient's total course of treatment should be completed by treating doctor and given to the patient within 1 month, and it will be served as a reference when he or she seeks further treatment, consultation, and admission at any hospital or primary health center. Original copy of the discharge summary should be kept in patient's medical record. Discharge summary form must contain full name of the patient, medical record number, age, sex, nationality, name of the treating doctor, department, and unit. Date of admission and discharge, diagnosis of the patient, history of the patient, physical findings, and investigations done. Diagnostic and therapeutic procedures performed, final diagnosis of the patient. Medication and treatment given in the hospital. Patient condition at discharge, including vitals. Discharge medication and follow-up instructions, and treating doctor name and signature with stamp, including date and time. Outpatient department appointment office is responsible in giving appointment schedule to all discharged patients that need follow-up. Prescriptions for take-home medications must be stamped by the treating doctor before forwarding into the pharmacy department, where the nurses will be responsible to give proper instructions on patients' home medication. All discharged patients should vacate the bed within 2 hours post-discharge order. If patient refuses or is unable to go on the specified time, the nurse should call and inform the patient's relations officer for assistance ordered by the treating doctor. 2. Discharge from emergency department. Patient's discharge from ER must be done by the attending physician with all instructions, including home instructions and medications, OPD follow-up, leave days if necessary. 3. Police medico-legal case. Hospital police should be informed before discharging medico-legal cases. Prisoners should be taken by a police officer upon discharge. 4. Patient confidentiality. The information contained in the medical record belongs to the patient and is entitled to the protected right of information. All patient care information should be regarded as confidential and available only to authorized persons. Procedure. The physician finalizes the discharge planning process based on the interdisciplinary assessment to ensure that all areas of need have been covered. The treating doctor during rounds checks the patient condition, if fit or ready for discharge, and all needed laboratory radiological results are available. Discharge order is written in the medical record on the doctor's progress notes, home medications on doctor's order sheet, and the doctor has to affix his name and signature, including date and time. The patient hospital ID band, hospital gown is removed, and he or she should leave the hospital within 2 hours after discharge to vacate and prepare the bed for a new admission. Responsibility. The treating physician should document and inform the patient and the family of the discharge plan and expected post-discharge needs. Write discharge order, prescription, future appointments, and supplies. Give instructions and health teachings to both patient and family about the prescription, future appointments, and supplies that's necessary for the patient's continuity of care at home. Refer patients refusing to be discharged to patient relations officer and inpatient departments as indicated. The assigned nurse should maintain nursing documentation relating to discharge and teaching. Complete the nursing discharge summary notes, ensuring that the patient understands all discharge medications, medical instructions, and has necessary supplies needed. Attempt to discharge the patient before 11 o'clock and ensure that the admission and discharge office have been notified when the room is vacant. Here is an example of the discharge summary form, its first page. And this is the second page of the discharge summary. And here is another example of the detailed medical report form. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.